inside their bodies. At first, an infected person may simply feel tired. The body becomes weak, energy disappears, and ordinary tasks suddenly feel exhausting. Then comes fever, muscle pain, headaches, chills, and body aches. These are symptoms millions of people experience every year during seasonal illnesses. Because of this, many individuals assume they only need rest, medicine for fever, or a few days at home to recover. But sometimes, what looks ordinary is hiding something serious. This is the frightening part about the early stage of the Hantavirus. The symptoms do not immediately reveal the severity of the infection. A person may continue working, traveling, or interacting with others while believing they only have a temporary sickness. Families may not worry. Friends may not notice anything unusual. Even patients themselves may ignore the signs because they resemble conditions people have experienced many times before. Human beings often underestimate illnesses that feel familiar. We become comfortable with symptoms we recognize. A headache seems manageable. Fever feels temporary. Body pain feels normal after stress or exhaustion. That sense of familiarity creates delay, and in some cases, delay becomes dangerous. The body, however, is quietly fighting a battle inside. While the infected person assumes recovery is near, the virus may continue affecting vital systems. This is why medical awareness is so important. Diseases do not always announce themselves loudly. Some arrive wearing the mask of something simple, making it difficult for both patients and families to understand the urgency of the situation. There is also an emotional side to this experience. When people feel early flu-like symptoms, they often convince themselves everything is under control. They continue daily routines because stopping feels unnecessary. Some avoid medical care because they fear overreacting. Others cannot afford to miss work or responsibilities. Many people wait until symptoms become unbearable before seeking help. Unfortunately, by the time severe breathing problems begin, the condition may already have progressed significantly. This pattern is not unique to the Hantavirus. Humanity has repeatedly faced illnesses that started with mild symptoms before becoming life-threatening. Yet people continue to trust appearances more than caution. We assume that if something feels common, it must be safe. But nature does not always work that way. What makes the situation even more challenging is that early symptoms can vary from person to person. Some people may experience intense fatigue first. Others may notice dizziness, nausea, or stomach discomfort. In many cases, the signs appear slowly, making it difficult to recognize a serious pattern. This uncertainty increases confusion, especially in areas where awareness about the virus is limited. And this is where education becomes powerful. When communities understand that flu, like symptoms after possible rodent exposure, should not be ignored, people become more alert. Awareness encourages earlier medical attention. It helps individuals connect their symptoms with possible environmental risks. Someone who recently cleaned an old storage room, visited a rodent-infested area, or handled contaminated materials may realize that their simple flu deserves serious attention. The human body has an incredible ability to survive, but survival often depends on timing. Early recognition of illness can mean faster treatment, better medical care, and greater chances of recovery. Ignoring warning signs because they appear ordinary can allow a dangerous condition to grow silently. Perhaps this teaches us an important lesson beyond medicine itself. Not everything dangerous looks frightening in the beginning. Some of life's greatest challenges arrive disguised as ordinary moments. A small symptom, a little exhaustion, a mild fever, things people brush aside every single day, yet hidden beneath those ordinary experiences may be a serious battle unfolding silently within the body. And that is why awareness matters so deeply. Because sometimes the difference between safety and tragedy begins with whether people choose to pay attention to the small signs their body is trying to reveal. At the beginning, the illness may seem manageable. A person may believe they are dealing with nothing more than fever, weakness, or body pain. They may expect rest and medicine to solve the problem within a few days. But in severe cases of Hantavirus, the situation can suddenly change in terrifying ways. What begins as ordinary discomfort can turn into a serious struggle for breath, transforming a simple illness into a life-threatening medical emergency. The lungs are among the most important organs in the human body. Every breath a person takes carries oxygen that keeps the brain active, the heart beating, and the body alive. Most people never think about breathing because it happens naturally every second of their lives. But when the lungs begin to fail, even the smallest breath can feel like climbing a mountain. This is what makes severe Hantavirus infection so dangerous. In some patients, the virus attacks the respiratory system and causes fluid to build up in the lungs. Slowly, the lungs lose their ability to deliver enough oxygen to the body. Breathing becomes harder. The chest feels heavy. Simple movements become exhausting. A person who is walking normally one day may suddenly struggle to speak or stand the next. And perhaps the most frightening part is how quickly the condition can worsen. Many illnesses progress slowly, giving people time to react and prepare. But severe Hantavirus cases can escalate rapidly. Someone who seemed stable hours earlier may suddenly require emergency medical care. Families often experience shock because they do not expect flu-like symptoms to transform into a breathing crisis so quickly. When the lungs are affected, fear becomes very real. There is something deeply terrifying about not being able to breathe properly. Human beings can survive hunger for days. They can survive exhaustion, pain, and many hardships. But when air itself becomes difficult to reach, panic enters the mind immediately. Every breath becomes precious. Every second feels uncertain. Doctors and medical teams often have to provide oxygen support or intensive care to help patients survive severe respiratory complications. Hospitals become places where machines assist the body in doing what once felt effortless, breathing. This reality reminds humanity how fragile life truly is. One invisible virus can suddenly make the most basic human function feel impossible. The emotional impact on families is also enormous. Watching a loved one struggle for air creates helplessness no words can fully describe. Families wait outside hospital rooms praying for improvement, wishing they could somehow carry the suffering themselves. Medical workers fight tirelessly to stabilize patients, often knowing that every hour matters. But beyond fear, there's also an important lesson hidden within these severe cases. The body gives warnings before collapse happens. Symptoms may begin mildly, but they should never be ignored when they worsen rapidly. Difficulty breathing, chest tightness, severe weakness, or sudden respiratory distress are signs that require immediate medical attention. Awareness can save lives because recognizing danger early allows doctors to respond faster. The effect of Hantavirus on the lungs also teaches humanity something humbling about health. People spend years chasing money, success recognition, and endless goals, yet few stop to appreciate the simple blessing of breathing freely. Most individuals only realize the value of a healthy breath when breathing becomes painful or uncertain. Sometimes life's greatest gifts are the things people notice the least. Air, breath, normal moments. Severe illness forces people to confront realities they usually ignore. It strips away illusions of control and reminds humanity that the human body, despite its strength, remains vulnerable to forces invisible to the eye. Yet even in the middle of suffering, hope continues to exist. Medical science keeps improving. Awareness keeps growing. Doctors, researchers, and healthcare workers continue searching for better treatments and faster responses. Communities learn from outbreaks. Families become more cautious. Knowledge spreads, and with knowledge comes the possibility of prevention and survival. Because while severe cases of Hantavirus can affect the lungs in devastating ways, they also reveal something powerful about human beings. Even when breathing becomes difficult, people continue fighting for life with extraordinary courage. And perhaps courage is most visible not when life feels easy, but when every breath becomes a battle worth fighting for. Human beings often live with the belief that modern medicine has an answer for almost everything. Hospitals are filled with advanced machines. Scientists work in sophisticated laboratories. And technology continues to grow faster every year. Because of this progress, many people assume that every dangerous disease already has a cure waiting somewhere on a shelf. But the reality is very different. The Hantavirus reminds the world that despite all scientific achievements, humanity still faces illnesses for which there is no specific universal cure.